Healthcare continues to be an ongoing issue emotionally, mentally, and physically. Some of our communities do not have consistent access to local health aides, and even if there are health aides, people have to travel to Bethel for injuries or unmet health needs in our communities. Not all, but a lot of residents are abusing alcohol and substances, even with our overcrowded homes, which leads to a lot of issues related to domestic violence, substance abuse, and alcohol abuse. We need more support in all communities, a go-to place where we can send our loved ones to because family members are the ones treating these issues without enough training in that field. How can we help bring these resources to our communities? How can we build health systems that can address these problems?
Well, look, I think the way in which the question was asked is a really important issue because you're focusing on a holistic way to look at it, and I couldn't agree more. You know, when you're talking about alcohol abuse, when you're talking about housing, when you're talking about domestic violence, all of these things obviously relate to our health. So we can't just look at it in terms of just the clinics and the hospitals, but a broader well-being. And one of the things that I've been very focused on are a number of those issues. For example, mental health, the ability to address the challenges of addiction and mental health. It's been a passion of mine to address not just alcohol addiction, but some of the drug addictions that we're seeing. So we've had a lot more resources for that, for people's mental health and addiction. I know we're going to talk about public safety, but I'm passionate about more resources for victims and survivors of domestic violence and changing our culture so we respect women and children, and they shouldn't be abused. I will continue to speak out on that. But with regard to the broader healthcare system, it's a really important issue that you raise. The Alaska Native healthcare system is actually, for our Native people in America, it's probably the gold standard. It's not perfect, but it has done very, very well relative to other Native American healthcare systems. We do need more resources beyond just Bethel into the villages, and it's something that I care deeply about. But we want to make sure that we continue to build up the Alaska Native healthcare system with more resources. During the pandemic, the IHS had an increase of over $100 million at my request to the White House to get more funding to our Alaska Native healthcare system. And then finally, I'll just say the most immediate issue right now, not only am I a strong supporter and defender of covering people with pre-existing conditions, I've fought for that, I believe in that, and I will continue to fight for that. But as we get through this pandemic, I've literally talked to the president, the vice president, everybody in the federal government. Our Alaska Native communities have to have the resources that everybody else has. We've been through, some of our rural communities have been through horrible, horrible pandemics like the Spanish flu, and we need the resources both in testing, medical personnel, and importantly, soon, I believe we're going to start to see a vaccine for the COVID-19. I'm already pressing the top federal government officials saying, make sure Alaska Native communities are on that list to surge out the vaccine and more testing so we can get through this COVID challenge stronger and more resilient and healthier than ever.